So the health department has issued caution after 2 new Mpox cases. They were detected in Gauteng and KwaZulu-Natal, bringing the total number of cases to 24. But to tell us more, we are now joined by the department spokesperson, Mr. Foster Mohale. Mr. Mohale, good morning to you. Thank you so much for joining us. I think let's get the clarity right now on the numbers and where they sit. So the number of confirmed cases in South Africa where Mpox is concerned, clarify what that tally is for us.
Good morning to you, Naledi, and good morning to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health, we can confirm that after 26 days without recording a positive case of Mpox in the country, we have recorded 2 more laboratory confirmed cases in the past 3 days, while we were on the verge to declare an outbreak over. Now we see new cases emerging, even though we did warn the public that the fact that we did not have any positive cases for almost 3 weeks, that didn't mean the transmission of this infectious and preventable disease is over. Hence, we want to encourage people to remain vigilant at all times, and those who experience Mpox like symptoms, not to waste time, not to self-diagnose, not to self-isolate, but present themselves at the nearest healthcare facility so that the healthcare workers can be able to diagnose them. If they test positive, we'll put them on treatment. But also I wanted to confirm that we have received another batch of Mpox-specific treatment for those who experience serious health complications.
Okay, and we'll get into the treatment. I just want to look at these numbers a little bit more, if you'll allow me, because you've got 12 in Gauteng, 11 in KZN, and 1 in the Western Cape. I mean, have you looked into why there'd be such large numbers in Gauteng and KZN versus perhaps the Western Cape?
Yeah, maybe the one other thing, maybe the issue of a population might be another factor. As we know that Gauteng is the most highly populated province in the country, followed by KZN, followed by the province of Western Cape. But that should not fool us to think that the disease is only transmitting in this province. This is the province where people were able to come forward when they experience Mpox-like symptoms. So we want to encourage other people in other provinces, because some of these patients, their travel history, they went from one province to another. But even though we did not, during our contact tracing, we did not pick up any positive case in other provinces like your Limpopo, your Free State, and so forth. So we want to say to all South Africans, the fact that these 3 provinces are the most affected so far doesn't mean we are safe in other 6 provinces.
Yeah, and maybe a really great place to go next, Foster, is to talk about the process of identifying a case. I mean, so with the 24 cases that we have recorded, what does the process look like of identifying them? So how is it that you have been able to find them, and the symptoms that people should be looking out for? Because I think that perhaps we need to be, fueling and strengthening the education around Mpox. Certainly when you do have the WHO looking to even ramp up efforts, and we'll get into that in a moment as well.
Yeah, no, yeah. Mostly, once we are able to identify other cases or other patients through one patient through what we call contact tracing. For example, if I test positive, I have to give the names of all the people that I was with, the friends, the colleagues, the classmates, to our health officials, so that when they do the case investigations and contact tracing, they go back to those people that I spent time with in the past few days, so that just to screen them and test for those who experience any Mpox-like symptoms, so that we're able to prevent further spread among a community of people. So this is how we managed to identify further patients. So even this one, we tried to reach out to all those who were in contact with the recent 2 patients. You never know, some of them, they may test positive or not, but our wish is that, and our intention is to ensure that anyone who was in close contact with the 2 patients, we plead with them to cooperate with our health officials when they do contact tracing and case investigation, so that they're able to prevent further spread of this infectious but preventable disease.
And what does close contact mean? So if I do know someone who has been diagnosed with Mpox, what does close contact mean? So how was it transmitted? I think that's the question. Yeah.
Yeah, Close contact means simply means that we spend most of the time together. We were either close physical contact, we were either shaking hands, we were hugging, we were kissing, and other or sexual contact. So these are some of the close contacts that we are able to reach out. I mean, immediate close contact that we try to reach out, but also not necessarily hugging and kissing, physical contact, but also those we shared a number of physical items like objects. We're in the same space. We're sharing the utensils. We're sharing the clothes or the blankets and other objects. So this is the close contact that we are talking about.
Yeah, and then of course we're hearing from Tedros Ghebreyesus of the WHO saying that they're seeing a deadlier strain of Mpox reaching African countries. I'm wondering if that's something that we are seeing here, if the strain that we're getting lately is deadlier than what we would have had previously. I know that they have donated Mpox, the medication. But what do you make also, and you can respond to all of that, but what do you make of the WHO chief also thinking about calling an emergency committee on Mpox? Is that a step in the right direction?
Yeah, no, definitely the WHO, they always try to be as proactive as possible, as we've learned a lesson from COVID-19, that we need, especially once we declare an outbreak of a disease, we need to intensify our response and preparedness activities without wasting any time. But with regards to the issue of strain, there are different types of strains across the world. Different countries, they experience different strains. Like enough, the strain that we are experiencing in the country is different to the strains that is being experienced in other parts of the world, but also on the parts of the continent, like your DRC, your Nigeria. That the strains that they're experiencing is more severe, more transmissible, more deadlier than what we are currently experiencing in the country. But that doesn't mean we must lower our guard, because we learned from COVID that we say the disease or the virus mutates. Mutates means if the virus was severe, suddenly becomes less severe. If it's less severe, suddenly becomes severe and transmissible. So far in the country, we are lucky we are dealing with a virus which is less severe, less transmissible.
Yeah, and just lastly, before I let you go, I think one thing that we can certainly talk about here in South Africa is the success rates that we have in treating Mpox. Talk to us about that. And then I'm also quite keen in talking about prevention, because as we educate people, we also need to talk a little bit about prevention, particularly when we start talking about a disease that can be sexually transmitted as well, right? That there is some sort of control that all of us do have.
Yeah, no, in terms of the success rate of the treatment, let me start with the first 22 cases that we have experienced. Only 3 people lost their lives. 19 of them had fully recovered. Hence, I said at the beginning that we were on the verge of declaring the outbreak over. So in terms of the success rate, I strongly believe that we are doing well as the country, working closely with the organizations like your WHO and other partner organizations in the country. So we are doing well. But in terms of prevention, yes, we have been intensifying health awareness education in order to empower our citizens with the correct message so that they're able to make well-informed choice. So prevention is better than a cure. So we can do more, we can save more lives if we intensify health education. But also want to thank the media houses like your Newzroom Afrika. We've been giving us enough airtime in order to educate South Africans. They will appreciate that. Let's continue to work together as government and the media in order to empower our citizens with health education to make well-informed choices.
Yeah, the information is so important. So we appreciate you making time for us as well. Foster Mohale, of course, is the spokesperson for the National Department of Health, speaking to us about that resurgence of Mpox. 2 more cases now having been found in the country. All right, you're still